welcome to Let's Nourish Ourselves, our interactive module where we try to help us understand how to nourish our mind, body, and spirit, and in today's episode, especially with food. My name is Dr. Bhavna Pathak, and I'm a hematologist-oncologist and the medical director of Integrative Oncology. I'm joined here today by the wonderful Mandy Trimmel, registered dietitian here. Mandy, hello.
Hi, thank you so much for having me. I am so grateful to be a part of this conversation and this project. I am a registered dietitian out of Saddleback Memorial in Laguna Hills, and this has really been a labor of love for our dietitian team as we kind of put our heads together and collaborated with some of our other dietitians over at our sister hospitals through Orange Coast and Long Beach Memorial to try and really come up with a resource that could be beneficial for patients and families, especially those entrusting us during their cancer care.
Yes, what a wonderful role you play, and we really, really value your input, expert input in today's discussion. Today we're hoping to speak about supplements, and as an integrative oncologist, alongside being a conventional oncologist, it's really important that I address patients' questions about these with respect and honor, because most patients actually do engage in some form of alternative practice alongside their conventional treatments. And so it's important to understand where patients are coming from and the reasons why they might be choosing to use a supplement. So to start, can you explain to us what is a supplement and why patients might be interested in using them?
Yeah, so supplements, there's kind of a wide variety. It can be a vitamin or mineral that is definitely considered a supplement. It can also be an herbal or botanical supplement. There are also supplements which are nutritional amino acids or enzymes, things that are naturally found in the body or broken down in the body. So there's kind of a wide range. And I think that one of the most common things that I hear with supplements is they're really looking for an outcome. And one thing I'd like to make really very clear today with supplements is supplements are not intended to, number one, replace whole foods, and number two, they're not intended to treat, to diagnose, prevent, or cure disease. And so if that is the reason you're seeking them out, if that is the claim of the product that you're taking, think twice. Be more conscientious about it. And while some supplements may be safe to take, others may not be, and others may interfere with medications and treatments. So it's important to be really mindful and intentional about what supplements are appropriate for you.
Yeah, I think that's very well said, Mandy, because too often I take care of patients who just well-meaningly want to take a supplement that they've read about or a friend told them about, or and they're really just trying to take part in their own care. And from what I'm hearing, it's important to engage your healthcare team, be very open about what you're taking so that they can perform the appropriate medication reconciliation. And also just be mindful that there might be different times in which it's beneficial to use these more than others. So in general, how safe would you say supplements are to take during treatment?
So during treatment, I'd say there's a lot of things to consider. So I loved what you said about talking with your healthcare provider. Oftentimes we get that questions like, are you taking any medications? Mm-hmm. And sometimes we don't even think about the supplements that we're taking because we don't consider them medications. So make sure to communicate with your healthcare provider about any supplements that you're currently taking. Generally, during treatment, it's pretty safe to take a multivitamin with minerals, especially if you have a decreased appetite and you notice your intake is a little bit lower. This might help fill in some of the gaps. It's definitely not a magic pill, and I would say that it's not something that you should blanketly do. Again, talk with your provider if it's appropriate for you. And there really isn't any evidence out there to support any one supplement or any regimen of supplements during treatment. Every patient is so individual. The treatments are individual. Your needs are individual from a nutrition standpoint. So there really isn't a blanket recommendation or anything that you would consider safe to take without having that conversation with your healthcare provider.
I totally agree. And as part of the Society of Integrative Oncology, there are consensus statements that are put out there to corroborate what you're saying, that, hey, there's no one pill that's a magic pill. And there's often this cloak of sort of goodness put around things that are botanical and herbal. And what I often educate my patients with cancer is that actually most chemotherapies were derived from plants and they were organic. And you know, it's just nice to know that in some ways, a lot of the products we use were natural, but we can, you know, with science, we can sort of maximize that, and sometimes that's not always a good thing, right? So what are some things to consider before choosing a supplement if you decide to go down that road or in conversation with your doctor? What are some things you would recommend?
So the first thing that I would want to make sure every patient knows is that there is no governing body to regulate the supplement industry. So the FDA, the Food and Drug Administration, will regulate medications and other things before they get put on the shelf to make sure they're safe, to make sure they're effective, to make sure those claims are accurate. There is no such regulation for supplements. So any manufacturer can put whatever they want in a bottle, label it with whatever they want, and sell it if they have the funding to do so. So as a consumer, it's really important that you do your homework. It's really important that you do your research. Look at the claims, the ingredients, the directions for use on a supplement. Anything that sounds maybe fishy, a little outrageous, maybe too good to be true, is definitely a sign to stop and reconsider you know, what you're going to be consuming. Now, although the FDA doesn't regulate, there are a few agencies that are third-party tested or third-party testers, and they put their stamp of approval on certain products. So as a consumer, you can feel a little bit of comfort seeing these seals on your supplements. They check for potency, for purity, for composition, and other criteria for the product. These companies are US Pharmacopoeia, consumerlabs.com, and NSF International. So if you see that seal, you know that they have been third-party tested. Now, I will say that although that is a good step, that is not the end-all be-all. We still don't know how this interacts with the other medications you're taking or if it's safe to consume. All that company is certifying is that what the manufacturer is saying is in the bottle is there. So again, and you'll hear me say this a lot throughout this module, you want to make sure to consult with your healthcare team before taking anything. And this would include vitamin or mineral supplements in high doses. So a multivitamin is going to have really kind of moderate to, you know, base needs of a variety of vitamins and minerals. But you can take high doses of vitamin C, for example, high doses of vitamin E, which in theory are good antioxidants. They are good for the body in terms of healing and controlling inflammation. But when you take it in a supplement form, you can take too much, and it can be harmful for your body. It can interact with the treatments that you're taking, and it can make some chemotherapies less effective. So you definitely want to consider and stay away from any high doses of particular individual vitamins and minerals. Along with that, some supplements can make your skin more sensitive. So if you're undergoing radiation and you're taking a supplement for another reason, one of the side effects may be skin sensitivity and kind of hurt or hinder your recovery from your radiation. Your provider will be able to help you navigate that and give you that information. There are a few too that are pretty big no-nos during your treatment. These would be things like St. John's wort, golden seal, echinacea, and garlic oil. These have a lot of interactions, common interactions with the different treatments that that our patients are undergoing during their cancer treatment. So as just kind of a golden rule or rule of thumb, we want to stay away from those ones.
Okay, great. I think that's a lot of great information, Mandy, that you just shared. And the takeaway I got was that, you know, there are ways that we can show that a given manufacturer has that product within it, but that does not necessarily mean that that product is safe with your particular treatment or even in general. as an oncologist, I commonly see patients who admit later in their course that, oh, I was taking this. And the saddest moments for me are when there's an interaction that we did not foresee, especially because there's only so many ways your body can process some of these chemicals they are chemical compounds at the end of the day that have some therapeutic effect. So in addition to those sort of organizations that provide some third-party stamp of approval, I like to guide my patients towards certain databases that check interactions or provide information that are more cancer specific. So my particular favorite is About Herbs from Memorial Sloan Kettering, where you can look up a certain compound and see in patient language and also healthcare provider language what the current research is. Because I think if we empathize with each other, if I empathize with a patient who's just wants to help themselves or just wants to help their loved ones with a supplement, it helps me understand them. And if a patient is able to empathize with us as providers and clinicians, as healers, that hey, we don't want to do any harm. We don't want you to be harmed. And so I think when we take that shared approach, we're going to be looking towards the best outcomes together. So now, with all of this, do you have any takeaways for choosing and using dietary supplements?
Yeah, I think what you mentioned earlier about kind of doing the legwork and doing your own research with reputable sites and reputable information, that could look like the website that you mentioned. It could be research study that's funded by government or independent agencies, not the company that's producing the product. That's going to be really important because that's going to allow you to bring it to your provider and be able to have a conversation about what your concerns are or what the potential benefits or risks might be. You also want to just keep in mind that it's not beneficial to have a whole variety of supplements in your diet. There are so many individual interactions and so many things that can interfere with your overall treatments. So if you're having a mixture of different supplements, make sure to take a pause and have that discussion. I also recommend if you're going to start anything new, let's say you get the green light from your provider to start something, start one thing at a time. Use the dose as directed. Do not, go above and beyond, even if you're feeling good, because who knows where that will lead, down the line. So start with one product at a time and follow the directions on the label.
Yeah, well said. I think that's very true. Doing your research, avoid mixing multiple different supplements. Too much of a good thing, every vice can become a virtue. And something that I also like to add to my patients who have this inquiry is to consider it like a red, yellow, green light approach. So times to kind of maybe hold off on too much experimentation include during the active treatment, because that's when the risk is greatest of using certain supplements. And as you emerge out of sort of the active phase of your treatments, considering a more open-minded approach, even trying some of these things as they suit you. I think that's a safe guideline in terms of how to explore these things, and always with your provider, just because they're part of your team, they're invested in your care, and many patients do not share with their oncology provider that they are using it, and we're working to change that with the conversations we have today. So thank you for sharing that. Any recommendations for specific things for patients wanting to manage symptoms while going through cancer?
Yeah, there are a few things that are pretty safe to take to help with your symptom management. These would be things like ginger or vitamin B6 for nausea, but both of those are very well tolerated by the body. They have very low or no interactions with the different medications or treatments that you might be taking. Aromatherapy is another good option that is safe. Essential oils such as lavender, peppermint, or ginger can help with nausea. They may also help with sleep and reduce fatigue. Lavender and sweet marjoram may help with anxiety. Sweet marjoram has also been shown to maybe help ease some of the pain patients might be having. So some of these, and they are kind of time-tested been around for a long time remedies that can be beneficial without doing that harm of experimentation on, what'll happen if I take this.
Right, yeah, and I love that. Appealing to our senses and that ancient wisdom of using all your senses, and aromatherapy as a potentially very powerful tool, what we call cranial nerve 1. Really the most ancient nerve that we have is our sense of smell. So from our sense of smell to maybe our sense of taste, what about foods? Can patients get benefits from certain foods without the risk associated with like supplements? And what's coming to mind for me is like turmeric. Turmeric is great in a soup, great in dietary portions, but sometimes you get it into these 1,000% potencies, and that can complicate treatment. So tell me more about that.
Absolutely. The way, that food is designed, it does have these naturally occurring benefits within them, but it also comes along with a whole host of other things. You're getting that, wrapped in a fiber cell or next to this other phytonutrient that's going to help the way your body digests it and absorbs it and utilizes it, versus in a supplement form where we've taken and extracted that one thing out, that one nutrient out, or that one chemical out of the food, and we've concentrated it. It's a whole different way that our body processes it. So it's a lot safer, and you can still be getting the benefits from these foods in a much safer way by eating the food rather than by taking the supplement. Some examples of these would be antioxidants, right? Eating foods that are rich in antioxidants are great for our cancer patients. Before treatment, during treatment, and after treatment. These can be things, they're typically plant-based foods, and they can be like veggies like artichokes and bell peppers and sweet potatoes. Most people are familiar with the fruits, right? Berries, raspberries, strawberries, and blackberries. Antioxidants are also found in nuts and seeds and grains like walnuts and pecans and barley and pumpkin seeds. So all of these are great things to help bring into your diet. Any place we can add them is a good thing. Another kind of functional food that we see that has benefit is probiotic foods. So this would be anything that has kind of that healthy bacteria that's going to help stimulate our gut microbiome and help support those healthy gut bacteria that we have. This is usually found in things like yogurt and fermented foods like kimchi. And then you have prebiotic fibers. These are foods that feed those bacteria. So they're fibers that help those bacteria grow and flourish. And science shows us, literature shows us that when our gut microbiome is healthy and thriving, that we have protective benefits. We have increased immunity. We have an increased production of things like vitamin K, because those bacteria will recognize that our body needs them and they'll actually make it. And so feeding those bacteria is important. So things like beans and nuts and seeds, fruits like apples and peaches and grapefruit, veggies like onion and garlic and green leafies and beets, all of these things, and whole grains provide these prebiotic fibers to keep our gut microbiome happy. A couple other ones that I think are really good. Flaxseed is another one that comes with a lot of really good omega-3 fatty acids. It is important to note that you want your flaxseed to be ground. You want it to be flaxseed meal, because we cannot digest the flaxseed itself. So make sure it's ground up. Chicory root is another really good one. That's a good prebiotic food. Oats are another great food that has a lot of protective benefits for our cancer patients. They have a lot of cancer-fighting phytochemicals. Algae and seaweed actually have as much protein as an egg, but also come with a good source of omega-3 fatty acids. So incorporating a variety of these foods, you're going to get the benefits without having the risk. Plus, you're going to get the benefit that also comes with the food. So this is definitely where we try to steer our patients and help them understand that there are lots of beautiful things in Mother Nature that can help support you in your cancer journey.
Yes, yes. I love everything you mentioned, and just kind of going through the family album of beautiful foods that are just here to nourish us from nature. I can't agree with you more that food is our medicine, and it's really nature packaged it in this most beautiful form. And some of my favorite examples that came to mind as you were sharing this were, the Native Americans chewing willow bark when they had pains, aches and pains, and indeed it contained salicylic acid that we now use in aspirin, or to even clear acne, right? And so we are, as humans, we've been able to extract it and create it in a much more potent form, which has select uses, but it also has select side effects that if we that are not seen in its more natural form. The same with antioxidants. So vitamin C that we enjoy so much from citrus fruits and things like that. The literature is still on emerging on the benefit of it, because counter to popular belief, inflammation is not always a bad thing. Sometimes inflammation is what our body needs to kill cancer. And so while in general we want to reduce any extra inflammation, which is served by eating these foods, it's really important to take a step back and talk to your doctor about the role of like these more potent, more unnatural antioxidants and supplements that we may try to use in more modern times. So thank you so much for sharing. And with that, I just want us to remind our audience of why we're here today, to nourish ourselves. So why don't you do the honors?
Let's nourish ourselves.